Well, welcome to today's webinar on the Suicide Prevention Hub. We know that suicide affects and takes roughly 3,000 lives a year. Yes, there's been a 5% drop in the last year of recorded figures, but still, any lives lost is an unacceptable outcome. 3,000 is a national and an individual tragedy which echoes through families, through workplaces, through schools and communities. So this is a fundamentally important topic. It's a personal passion, and it's one that I'm looking to address in the very near future with a very significant suicide prevention program. But I want to acknowledge and thank all of you who are working in this space, whether you're drawn by personal loss or more broader professional engagement. In terms of the Suicide Prevention Hub, it's about giving you as carers, professionals, medical leaders, community leaders, nurses, the ability to find in one place all of the materials that you need. We want your feedback. It's not a set and forget process. It's iterative. It's how we should do mental health and suicide prevention work. And the door is open. I'm always interested in your feedback on how to improve the hub, and in fact how to improve the Head to Health Gateway or any other of the resources in this space. So I want to thank you and acknowledge you. The work you do could not be more important, and my hope is that the hub will help you save lives and give people a sense of hope and possibility. And my hope is that the new work that we'll be bringing forward very shortly will help save lives and protect lives.
Well, welcome everyone. I'm Suicide Prevention Australia Chair Matt Tukaki. Thank you so much for joining us at this member-exclusive launch of the Hub sponsored by Redback. Before we get on with it, I want to make sure that we acknowledge the local Indigenous people of the land on which we meet today and pay our respects to the elders, both past and present, and also acknowledge wherever you are, the Aboriginal local owners of the lands on which you are sitting watching this webinar. I also want to acknowledge pain suicide brings when it touches our lives, and offer my heartfelt thanks to all of you who stand with Suicide Prevention Australia in our drive to support more Australians to live. Many of us bring personal experience and professional expertise to the work we do, and I would like to remind you to take care during this webinar and take a break if the discussion brings up difficult emotions in you. We will be publishing the webinar on our website in due course, so you will be able to come back to it in your own time. And don't forget, if you do want to reach out and speak to someone while the webinar is on, don't be afraid to give the good folk at Lifeline a call. 13 11 14 is that number, of course. There is a self-care document and service information in the resources section on your screen right now that you will be able to access. And of course, importantly, you are going to be able to ask questions anytime using the box in the bottom corner there. You may also see some poll questions pop up. So don't be afraid to ask questions as we go, because we've got an amazing crew of people in the room with me today. It's also a resource that offers support to organisations, so make sure you click on those links. The Hub is an online resource of evaluated quality suicide prevention programs and services assessed by independent external reviewers against a set of criteria. Now, I need to make something very clear. This is a momentous occasion, both for us here at Suicide Prevention Australia and also all of our members across the country, but importantly, individuals and communities wherever you might be. It is a turn in the right direction when it comes to making sure that programs that are basically out there in the community are evaluated and have the quality behind them to give you the confidence that they will work for you. We know there are a lot of people, well-meaning people out there, but when it comes to the lives of people we care about, as an individual, myself who has been impacted by suicide, I want to know that when it comes to programs and services out there, that we are making sure they are of the highest quality. I joined this journey with Suicide Prevention Australia 6.5 years ago because of the loss of my own best mate. and I want to make sure that everything we do, and I'm sure that Alan, who's a member of the Board of Suicide Prevention Australia, and also Christopher, another member of the Board of Suicide Prevention Australia, have that same commitment. So in saying that, please join me in welcoming Alan Woodward, Executive Director of the Lifeline Research Foundation. Welcome, Alan.
Thank you, Matt.
Christopher John, who's the Chief Executive of Service Supply United Synergies. Welcome.
Thank you, Matt.
We also have Regional Suicide Prevention Program Development Officer Melissa Cheras of Brisbane. Welcome, Melissa.
Thanks, Matt.
And you're from the North Primary Health Network, of course.
Yes.
Glad to know I got that one right. Suicide Prevention Australia's own Michelle Kwan. Welcome, Michelle.
Thank you.
Now, what a momentous day for you.
It's very exciting.
Because you've been working on this for quite some time, right?
Yes, it's been a big project and we've had a lot of support from the sector, so it's been a really great, exciting project to be able to launch today.
Absolutely. Now, I'm just going to ask some run-of-the-mill questions because I think it's really important just to set the scene for where we're going with all of this, and we'll deep dive into the hub as we go. But, Alan, you've been in the suicide prevention sector for quite some time. You've probably seen it all and heard it all. How important is innovation to you?
Look, it is important. I guess I've now been involved in suicide prevention for around 15 years. And one of the things that has been constant is the motivation and the passion that people bring to changing the world by reducing the number of deaths by suicide and providing a more compassionate response to those who end up with a suicidal crisis. But one of the things that's also changed in the 15 years that I've been involved is an awareness that we need more knowledge about how to be effective in our actions. Now, all of us want to be effective. We've got the same goal, the same vision we're pursuing, but we also sometimes wonder whether what we're doing is the best use of the resources and time available. Does it really work? And more recently, the voices of those with a lived experience and expertise of suicide have sometimes challenged us and saying, well, maybe the services and programs could be done differently.
Christopher, from your perspective as a frontline service provider, I mean, you work in some really interesting locations, both metro, remote, rural, regional, etc. How important is this for you?
Look, I think one of the strengths that service providers do is they provide service and support for people who've been bereaved or who are suffering or are struggling with their own suicidal thoughts. And that's the great strength that service providers do. They do the work. I think part of the challenge that we have as service providers is that we want to understand how we do that better. And, you know, to be able to have an opportunity to look at how programs are evaluated, get them peer reviewed, get some insights to how we can improve it, both from lived experience and from researchers who bring a different skill set to the table. And I think that's really what's going to add some benefit and increase the quality for what we need to do.
Now, we know that the hub is not intended to necessarily be everything to all people. That's not what it's designed for. It's definitely designed to act as a gathering place for programs that can be evaluated, but also if they don't meet the criteria necessarily, there is mentoring available to bring them up to speed and build that capacity. And we're going to be talking with Michelle a little bit about that later on. Melissa, now you work for a primary health network where regional suicide prevention in particular is a relatively new responsibility. And of course in our regions it is a significant issue. Tell us a little bit more about the work that you guys are doing.
Yeah, sure. So Brisbane North PHN is one of 31 primary health networks around the country, and we are federally funded. Our key strategic priorities are to improve the efficiency and effectiveness of medical services and mental health services for people in our region, particularly those who are at risk of poor health outcomes, and also to improve the coordination of care. So for us at Brisbane North PHN, our commissioning framework consists of sort of 4 key areas or strategies that are cyclical. So assessment of need, what are the needs in our region, co-design with our key stakeholders, community members, people with lived experience, delivery of those services, and then review and evaluation. And for us, the constant review and evaluation of what we're doing is critical, because that, as Alan said, we genuinely want to know if what we are investing in is making a difference. Is it actually making a difference to the people who need to be accessing those services?
Now, of course, if you've got any questions, don't be afraid to hit that button in the corner I mentioned before. Now, just picking up on that theme of evaluation, Alan. I mean, of course, you are also in the business of research and evaluation yourself through the Lifeline Foundation. Tell us why that is so important. Let's deep dive into that. Why is it critical to getting this right?
Well, I think evaluation has a couple of dimensions to it, but fundamentally, evaluation is the quest for knowledge. And knowledge is power in terms of helping us achieve what we want to do in suicide prevention. The other thing that evaluation is good at is it's a way of creating a learning process so that those who participate in the evaluation can use information or data or feedback as inputs to a learning process. And in that sense, evaluation, when it works well, is not something that happens every couple of years where the evaluator comes in and writes a report.
Yeah.
Evaluation is about a continuing process of learning and improvement based on knowledge and evidence.
So for you, how does the Hub facilitate that quality improvement? I mean, it's obviously critical in terms of the programs that we're putting out there. Can you tell us about the methodology underpinning the Hub?
I can a bit, and I was one of the expert advisory group members that fed information into the development of the Hub. One of the things that we thought was really important was to encourage people to see what sort of evaluations would be good quality, good standards of professionalism, what sort of inputs should research play in assessing a program or service for inclusion in the Hub. So in many respects, the Hub is simply representing what we would hope might happen anyway. It's not creating something in that sense that's terribly new, but what it does is it gives recognition and it provides a framework through which people can look at their services and programs and say, how do we know that this is working well? And what are the processes or criteria that tell us it's working well? And sitting back behind that are some things we know about what is the standard of good evaluation and professional evaluation.
Christopher, let's go to you now as a service provider on the front line. I mean, talk to us about the benefits and challenges of embedding evaluation into what it is you do. I mean, you see people every single day.
Yeah. Look, I think the first thing is it really is going to help us inform our service design better. You know, most suicide prevention activities and services in this country have started out of a tragedy in the community. And good-hearted people get behind to try and make something different and do something to address those issues. And what we need to do is collate our knowledge and experience around what works well and how it differs in different communities and provide some level of quality or certainty that what we are doing is actually going to make difference in a safe way. So it gives us some guidance around how we do that, and it sets some standards around what is a good quality program, what's a safe way to do it, and how can we actually replicate it and cater for the local needs in different communities.
Because that is key. I mean, sometimes you might run the risk of adopting a program or even starting a new program that could do more harm than good.
Yeah, and it's not because of ill will, it's just because we can collate different information from different areas that gives us a better perspective on things. You know, our lived experience, informative information over the last decade or two has changed the way we talk about suicide, the language around suicide, which has created a safer space to have those discussions. So I think it's really important that we actually bring that into space and make sure that it's the front of what we talk about.
So Melissa, turning to you, and this is a really important question, as a resource for an organisation like you who also operate there in the general community, how important is it to get this right?
Incredibly. So for Primary Health Networks, one of our key roles is being a backbone in the development and in the implementation of a regional suicide prevention plan. At Brisbane North PHN, we're at the stage now of we're just starting the implementation of that. So as time goes on and hopefully more funding comes through, our priority will be to be investing in and commissioning suicide prevention services and programs that have a strong evidence base or an emerging evidence base. Similarly, with the National Suicide Prevention Trial that we're a part of, along with there's 12 PHNs around the country, the purpose of that national trial is to trial a systems approach to suicide prevention, focusing on priority population groups. Guidance by the Black Dog Institute, who've been commissioned to provide support to PHNs, has been that where there is a strong evidence base for particular services, interventions, strategies to go with that, whilst acknowledging that for many of the priority population groups that the trial is targeting, that there isn't necessarily a strong evidence base, so the purpose of the trial is to be building on that. You know, so I mean, for PHNs, we do only have a finite amount of funding, and so it is, we we genuinely care about and value commissioning quality services. So, we do have a responsibility to make sure that the services that we commission can demonstrate that they do have an impact.
It's a fascinating insight into what goes on in a community, because you are right, Christopher, when you mentioned before that a lot of programs start with a community-centred approach. Something has happened in a community to bring people together and say, look, we need to find a solution to this problem. We want to prevent something from happening again. And of course, no community is the same, are they, Alan?
Well, they're not, Matt. And this is one of the things that we have really started to come to grips with in Australia, particularly through the reforms through the primary health networks. But as a consequence of the federal government's National Mental Health Commission review a couple of years ago into the suicide prevention programs and the mental health programs, one of the things that was identified there was that we don't want to play a standardised approach across a nation as big geographically as Australia, with diverse regional populations. And the data that comes forward from those working in the field of suicide prevention reinforces this. The profile of those who are dying by suicide varies from region to region. The social factors that might influence suicidal behaviours do change region by region. And Australia is a now very multifaceted population. So what we need to do is be smart about our suicide prevention. And in many respects, the trials that Melissa's referred to are showing the change in direction, that where we previously had one national suicide prevention program trying to make decisions on what would work for all regions in all places, we've now moved into a devolved approach through the primary health networks and these trials that are really going to help us generate some knowledge about suicide prevention. So, Australia has been looked at by other countries throughout the world with some envy, because we are a smart country. And whilst suicide is a very big issue in this country, we're taking a smart, learning-based approach to it. And the Hub is just one other extension of that.
Well, it's actually really interesting, because I remember a conversation with Jack Heath, who runs Reach Out.
Yeah.
And in one conversation, he managed to use the word innovation probably about 5 or 6 times. I mean, Australia is a hub of innovation when it comes to the suicide prevention approach. I mean, now, Michelle, just a question for you, talking about the hub in a little bit more detail before we get into a presentation. It's not locking any program out. It is about taking some programs that are ready for evaluation and passing them through, going through that process. But there's also an opportunity, isn't there, for those who don't quite make it? Talk to us a little bit about that.
Yeah. So while we know that the Hub is going to be a listing of high quality programs and services, we expect that there will be organisations out there that don't quite meet that criteria. And so the idea is not to exclude those organisations, but actually support them to build capacity within their organisations, whether it's through program evaluation or the design of their programs. So depending on what their needs are, we'll then be putting them through a mentoring program and supporting them through pairing them with organisations who may be doing it quite well to create that shared learning.
Okay, so in other words, there is always an opportunity for a program, no matter how small or large, to come through the evaluation process.
Yeah, that's right. There'll be a number of smaller organisations who we may pair with larger organisations that have that specialised expertise in a particular area. So that's a very significant and important component of the Hub.
And so I suppose, Melissa, for a PHN commissioning work out there in the field, it is important to see that evolution, isn't it? I mean, because you will come across a program, no doubt, that may not be evaluated, but can then go through the evaluation process, particularly if you need it to grow to scale in an area.
Yeah, absolutely. So certainly, as I was saying before, for us, and actually as Alan said, it's not just about at the end of a funding cycle, then doing the evaluation. For us, it's constantly reviewing and looking at both qualitative and quantitative factors as to how is the service performing, what can we all learn, how can we improve it better, how can we help to grow the evidence base. And that's something that we at the PHN see as one of our key roles as well, is around helping to contribute back to that evidence base through the services that we fund as well.
So for you, Christopher, as well, I guess the same concept of growing a program to scale is important because you're a cross-border organisation too, right?
Yeah, and look, I think, you know, as Alan mentioned as well, the demographics are different in different communities. So if there's something that we can learn about regional or remote communities in the implementation of different services from programs on the hub, then we're going to look at doing that and help shortcut the learning process and, you know, avoid making further mistakes there. So that's the opportunity that this does have, is that it's a centralised place where you can do some review and evidence review of what potentially could add value to what you're doing in your service.
Absolutely. Now, if you have a question for us or for one of the members of the panel, don't be afraid to ask it. And also just a gentle reminder, if anything that you're listening to during this webinar causes you to want to reach out and have a conversation with somebody or have a chat, or you're feeling some emotions well up in you, then again, the good folk at Lifeline are always available. That number is 13 11 14. And don't forget, there are resources available through this site. All you have to do is click the button and you'll be able to go through that process as well. Now, Alan, before we wrap up, what happens next? I mean, the people watching who run a program or service and want to get up on the hub, what should they be doing now before we go to Michelle's demonstration?
I think the first thing is gain some enthusiasm for the program and service that you have that you want to put forward into the review process, and approach it in a positive light. That is, a review process can be challenging because someone's going to form some opinions and, you know, there'll be some scrutiny of your program or service. But it is a good exercise because it's a potential to showcase what works well and maybe to also identify where there are particular things you want to do around improvement. The other thing I'd say is, as you prepare, gather the information you already have about the program. Now, sometimes that's not all written down. It's not just sitting there in an operating manual. So one of the key things that I'd encourage anybody involved in a service or a program around is give some thought to what your theory of change is. What is it that your program or service is trying to change, for whom, in what context? And that really is the start and the finish of describing a program in a way that allows you then to look at what data or evidence there is, how it can be applied to those questions, and how it can be fed into the criteria for the hub. Because, as I said at the start of our discussion, we are all interested in changing the world. We want to reduce suicide deaths, and we want to improve compassionate support for people who become suicidal. And everything we're doing in some way relates to that, but we'll do it in different ways for different people. And that's where the clarity around what is the service seeking to do, for whom, in what context, is so important.
Well, now it's time to take a look at what this hub looks like.
Yeah.
Michelle Kwan is joining us, obviously, to have a chat about the hub, the finer detail of how it's going to work, what you can do right now to have a look at submitting your programs for evaluation, and also answer any questions that you might have around how this will work. And don't forget, send your questions through. We're here. We're not going anywhere. We're more than happy to answer them. Michelle, over to you.
Great. So I'm really pleased to be able to demonstrate the hub to everyone today. It's been a very exciting project. Here you see, this is the landing page. We're on the home page now. You can search for programs by location, by the target audience and the setting for which you want to deliver that program. So we're going to do a simple search today. Let's look for a program in New South Wales, targeted at youth and to be delivered in a school setting. So when you put those fields in and you hit the search button, it will populate with a listing. Now, we piloted a couple of programs through the hub, and here you'll see we've got 2 listings. The first one there is Lifeline Safe Talk in Schools program, which has been listed as a quality program, and the Youth Aware of Mental Health program, which has been listed as a promising program. Now, the distinction between these two is that a quality program has had evaluation conducted within the Australian context. It's supported by strong evidence, and a promising program has been supported by strong evidence, but the evaluation may not be complete or it's currently underway. So when you select either of these, just as an example, the Lifeline Safe Talk program, the information provided includes a description of what the program or service does, its aims and objectives, It also does provide some information about what the model of delivery is. And there's a subset of additional information on the left-hand panel there, which gives you an indication of whether or not this program or service is appropriate to your needs. We'll also be including reviewer summaries there, so you can interpret the evidence that's been provided through the submission to see whether or not this program is suitable for you. We've also here got the listing for YAM, which is a promising program, and again, it gives you a rundown of the organisation. The information there is listing what the organisation's program is about. And again, as I'd mentioned, the promising programs, the YAM program is actually being rolled out through Lifespan at the moment, so the research is still underway, which is why it's been listed as a promising program, but there is really strong evidence internationally that supports this program. Now, if you're interested in submitting your program, you can click on the top menu bar, the Submit button, and that will take you through to this page here, which gives you all the information you need to gather evidence to submit your program. So it runs through the Hub's methodology. It goes through a checklist of what you need to prepare for your submission. It also provides some documents that you may need to gather to support that submission. And finally, it also provides a full submission guideline there for you. So I would encourage people who are looking to submit a program to have a look at this page in particular and really get familiar with what's required in a submission. Then once you are ready for a submission, you do have to create a login on the website. This enables you to save a draft of your submission, go back at any time to make an update, and then once you've created that registration and login, you'll actually then get taken through to the full submission questions where you can populate that at a time that suits you. So access to the Hub can be done via two different ways. You can submit your programs through the Suicide Prevention Hub website on the online portal, and the Hub is also publicly accessible through Life in Mind, which is coordinated by our friends at Every Mind. So if you'd like to get any more information about the Hub, visit the Suicide Prevention Hub website or get in touch with me and I'd be happy to run you through some of the finer details of the Hub.
Right, now we do have a lot of questions that have come through, so that's great to hear from our members, right? Don't forget, if you've got a question, go and hit that submit button. We're more than happy to answer it. Now, first question comes from Queensland.
Okay.
Who came up with the methodology? So let's talk about the methodology a little bit. And you mentioned an expert group. Talk to us about how this all came together.
Yeah, sure. So the expert advisory group is made up of a multidisciplinary group. There are individuals there that come from lived experience, academics, people representing PHN, and they've all come together to inform that methodology. So the rating scales that have been developed to assess quality have also been informed by the Better Evaluation Framework and the NHMRC Body of Evidence Matrix.
Well, it sounds quite interesting. Alan, from your perspective, I mean, this has to be the right approach by getting all of these people into a room to talk about how we are going to approach developing such an evaluation framework.
I think it is. I mean, this is, I think, part of how we succeed in suicide prevention is bringing a range of perspectives and expertise together. You know, no single channel, no single sort of area has got the whole lot sewed up in terms of suicide prevention. And the process that's been used to develop the Hub, as Michelle was indicating, has involved people from a range of backgrounds. It has involved a mix of professional, community, lived experience perspectives, and it has also drawn on some of the criteria and standards that already exist. So in a sense, what we're doing is bringing several worlds together. And that's the way that we are going to learn, is by looking at what different perspectives can come together, looking at a service or a program and starting to inform our understanding about that. I think this is really, again, part of the quantum shift that's occurring in suicide prevention in Australia, is it's not the domain of any particular professional group or any group in any particular location or organisation. It's about people from all walks of life working together and sharing their perspectives, so together we build more knowledge.
It's interesting because, there are, as we've all discussed, there are a lot of programs and initiatives going on out there, some that are evaluated, some that obviously aren't. But there are some commonalities and similarities between different programs. And I guess by having a hub, we're able to have a look more clearly at what those associations are. I mean, that's got to also be a good thing for a commissioning organisation.
Very much so. So, for us, obviously this is a new initiative, so we haven't yet had the opportunity to use it, but any resource that can help us to make more informed decisions around which suicide prevention services we commission is incredibly helpful. And then equally importantly, one of our big roles is encouraging our service providers in our region to, as Alan said, to really value and get excited about evaluation and how to go about that. Because we understand a lot of the challenges that service providers can have around time, how to do good evaluation. Is there access to local expertise? What are the costs? So having this hub that can provide that guidance and mentoring for providers is incredibly helpful, and hopefully will help to build the internal capacity of organisations to be able to do their evaluation and therefore build the capacity of the sector. Because as Alan said at the start, we all want to be reducing suicide, and we all want to be confident in the services that are doing that.
Well, on that point, a member from New South Wales has just emailed through a comment, or a question rather. I know evaluation is important, but we don't have the funds or the in-house capacity to do it ourselves, which is something that confronts smaller to medium-sized organisations. And of course, the other challenge for larger organisations is finding money in the budget to accommodate evaluation. So how much does it cost? I mean, have you got any advice for these organisations?
Yeah, I think part of the mentoring program in particular is about building connections and partnerships between organisations and in particular experts who are good at evaluation. So where can community, industry, all the different bodies, academia, get together and build on an evaluation program for a particular organisation? So I think there's a lot of room for that to happen in the mentoring program.
Well, I guess it's also important for organisations as they move forward and they feel as if they've got a program to grow to scale, an investment in both time and effort to go through the evaluation process is actually going to make it easier for that program to achieve scale. Would that be a fair comment?
I think it is. But I wonder if I might go to a more basic concern, perhaps, from that inquiry, because it is the case that in many situations where there is, funding given for a program or service, whether it's government or PHN or some other body, it doesn't include a line item for evaluation. I think one of the things that's going to have to happen for all this to work better is more partnerships around the resource side as well as the conduct of the evaluations. So that means perhaps service organisations forming partnerships with research bodies and evaluators. It might mean that we collectively look more to the philanthropic sector to fund the evaluation and knowledge creation. It might mean that we actually have fundraising for the evaluation side of what we're doing, which is really all about giving it more importance. But I don't think the answer will simply be about trying to squeeze it out of already tight operational budgets. It's about creating the resource pool so this can really work.
And of course, this comes back to something that we heard on the listening tour for all of our members out there. I recall it happening in Western Australia and South Australia and Queensland, where there was a deep desire to undertake evaluation of programs, but they just didn't have the funds available to do it. And I guess, Christopher, it is like anything, finding a creative way in many cases to try and achieve that end.
Yeah, and look, I think there is a challenge with government funding and allocation of dollars to research, but I think we can be smarter about it as well. Researchers start their projects by asking the right questions, and sometimes, if we can ask the right questions about what we're putting into the design, we collect data every day. So it's about how we collect that in an efficient way that we can then utilise for evaluation down the track or as part of an ongoing process. As PHNs are going to be looking for this as stepping the bar up every year from now on, what we do today is not going to be the licence to operate in 5 years' time. So we've got to get better at what we do in collecting that data and understanding the impact we have.
Okay, so we've got another question, probably more for you, Michelle, than anyone else. When many organisations deliver a program, for instance, mental health first aid and the Living Works programs, Assist and Safe Talk, how will they be listed in reference to the example shown, which was Lifeline Safe Talk?
Yeah, I guess this is something that's sort of emerged through our piloting process. So we found that in this particular instance where we've got an organisation like Lifeline and Living Works, who owns the original Safe Talk program, actually this was a collaborative submission that came through with all organisations involved. And so I guess the listing is actually specific to the Lifeline adaptation of the Safe Talk program, but acknowledgement has been made that it is, a program that has originally come from Living Works. And I guess this is a really good example of how, organisations can come together, because it is important to acknowledge the original program, but also that adaptations are what these organisations are, doing to learn, and they're delivering these services to the community. So.
Great, fantastic. We've got another question. This one's coming in from Trevor. So thank you, Trevor, for sending in the question. Will the Hub include programs that take a medium to long-term view of suicide prevention, perhaps by addressing risk factors such as social isolation? Yeah,
look, the criteria, as long as the program or service has suicide prevention specific outcomes or aims and objectives, I think it's eligible to come through as a submission. Of course, those risk factors are also contribute towards suicide in some way. So I think, those programs can be submitted, but as I said, they do need to have some specific link to suicide prevention.
And Christopher, I guess this speaks to the broader diversity of both not only the Australia, the sector, society and communities, but also obviously the plethora of risk factors that are out there.
Yeah, and suicide's a complex situation. It's not something that's just one factor typically in any case. So learnings from Australia and in the context of Australia are really important, but I think looking at abroad and how we apply research and learnings from other parts of the world in the Australian context will be really valuable in adding to the resource around what this hub can actually provide for the sector.
And I'm going to come back to a point made before, and I know you and I have talked about it off and offline, which is we often think that we need to go overseas to see best practice, but there is actually a significant amount of best practice and evolving innovative approaches going on right here at home.
Look, there is. I mean, Australians can be proud of the work that we have done in suicide prevention. Back as the 1990s, we were recognised as a country that formed a national strategy for youth suicide prevention, and we reduced the number of deaths of young people in this country as a result. So we have done some very good work, and we have some leading experts, and we have some leading people in the voice of lived experience. However, I think the other side of the coin there is that there is also things to be learnt from outside of Australia. So we can look to what's happening in the international circles and learn from that and apply it to the Australian context. And I think one of the things that is increasingly being understood is that there is sometimes a social and cultural dimension to suicide prevention. And Australia does have, well, in fact, a multicultural society, and it does have many contexts across the regions in this very large land. So we do need to be careful not to just take stuff off the shelf and say, well, because it worked in X context, it works in Y. We need to be a little bit more refined. And again, the hub is going to give us some tools that we can use to examine that and hold it up to say, does it really work for people in this country, in these contexts? But, I think you'll find that as the hub matures over the coming months and years, that we will see a complete showcase of the innovation that occurs in Australia. And a lot of it is born out of, as Christopher was saying, people in communities with the passion thinking of a new way to tackle the problem.
It's interesting because as an organisation that's geographically located, I guess this is also an opportunity for you guys at the Brisbane PHN to have to learn about other things that are going on in other areas, other geographic areas.
Well, that's exactly right. And certainly picking up on what you just said, Alan, for us it's around, well, I guess an example at our site was when we were commissioning commissioned a trial follow-up suicide prevention service. And for us, it was around looking at, well, what does the data tell us are the needs of our local region, looking at evidence-informed sources, documents, reports, lived experience, sector expertise, etc. And in our tender, along with our other commissioned services, evaluation is a line item in our tender documents. And so for this particular trial follow-up service, the organisation partnered with ASRAP to be able to do that evaluation. On top of that, we've also included a clinical component at this site, which came about through an identified gap in the region. And so out of all of that, we're really looking forward to seeing the outcomes of this trial and how it applies in our local region for that population and contributing back the learnings from this trial.
So we do have some more questions, thank you. We do have some more questions coming through, which is always good when you're running this this whole thing for your members. Joe asks, what about innovative programs that don't yet have an evidence base? How can we as a sector encourage innovation while still keeping quality at front of mind with initiatives like the Hub? Maybe if you can have a crack at that one first, and then we might go to Alan for a piece of commentary as well.
Yeah, it's a great question. We, of course, want to support innovation. So I think for organisations who are wanting to submit their programs and have perhaps not conducted evaluation as yet, they may be able to submit their programs through the promising category. Those are for organisations that have strong evidence to support that program or service, but perhaps the evaluation is underway or planned and it hasn't yet been completed. So there is scope for those types of organisations to submit their programs.
So when we talk about evidence, I mean, are we talking about the potential for anecdotal evidence, which is something I use all the time, incidentally, in my day job? Anecdotal evidence suggests, the types of stories emerging from a program that might be out there, or is it just about the data that they've already started collecting?
Yeah, so I mean, in the example that we have at the moment on the Hub, the YAM program is a very strong program that's been analysed overseas in an international context, but within Australia it hasn't been evaluated. So to Alan's point earlier about the cultural context being very important for the assessment of quality within this country, we need to ensure that, the programs that can be submitted will have that sort of evidence base, but they need to sort of further that evidence gathering within Australia.
No, fair enough.
Yeah.
So, Alan, talking about anecdotal evidence, as somebody who loves evaluation and that sort of thing, a lot of programs that are out there are centred around the stories of how they've impacted the lives of individuals involved within them. I mean, how important is it still to ensure that those programs come through?
Look, I think it is very important. I'm going to be a little bit controversial for a moment. Look, I actually don't think there are very many programs and services, if at all, that don't have some evidence about why they exist and what they achieve. Because, at the very starting point where somebody starts to design a service or create a new program, they're drawing on some assessment of need for, desire for, and why it would be a good idea. And if you really unpack that, you start to see, well, maybe it's anecdotal, but what is anecdotal evidence? It's actually people expressing comments and needs. What is it about that hunch that this is an unmet area in a community? It is because someone who understands the community has gathered information and possibly only in their mind, but possibly in consultation with others, has identified an unmet need. Now, all that is evidence. The question is more about how much evidence is there? How good is the evidence in relation to the program and service? So what we're interested in doing is building evidence, not coming at it from a false dichotomy of saying it's either evidence-based or it's not evidence-based.
Yeah.
No, I think the reality is that everything has at least some evidence, but we're trying to encourage sound, rigorous evidence collection and translation. We're trying to up the ante in terms of the breadth and quality of evidence, and that's what the hub is all about. It establishes criteria that allows you to sift. So a program that might be in the early days will have some evidence around its effectiveness or its the reason for its existence, might not get onto the hub as a quality program at this point, but the process will start to outline what's the additions to the evidence that would get it there. And that's where the learning process comes in. That's where we're all starting to build the evidence.
And I guess it's really important for smaller organisations and medium-sized organisations out there to understand that the evidence is probably there in some form. It's also about how you collect that evidence, right? It's about that collection method. And in some cases, it could be as simple as recording the number of interactions or the X, well, the Y. We're not talking about something that's wholly complicated.
No, it's not as though we have to limit ourselves. And again, this is part of understanding how we learn together. I've worked in areas of evaluation for more than 20 years, and I've seen some evaluations of emerging services or programs, really, ideas that people have had, and they've said, I don't know if we have any data. Well, data is one part of evidence for sure, but you can generate data. And you can be creative. I did one evaluation of a very modest program around sustainable transport options here in Sydney years ago. And we didn't have a lot of quantitative data, but once we started to use video evidence around what people's behaviours were on transport modes, their reactions to some of the visuals that were occurring in the community, and we interviewed people, we created data. Now, there are researchers and evaluators who can show how to do that in a rigorous and scientific way. We don't need to compromise on the science of it. We simply need to be broader in our thinking and sometimes a little more creative about what the source of the evidence can be.
Absolutely. Now, we've got another question, this time from Jill. She wants to know a little bit more about how to apply for mentoring. So how does that process work?
Yeah, the mentoring is available for organisations who perhaps don't make it in their first attempt for listing. So they would be invited to receive mentoring based on what their, areas of development are, so where they need additional support. And then we would look at that and work with other organisations who we could pair them with.
Okay, now let's have a talk from Tony. Another question's come in. When I go on the hub, will there be lots of programs on there that I can view and search from today? Because we talked about a couple of the pilot programs that you've already got up there.
Yeah, that's right. So we wanted to have a couple of programs up there for you so that you could see, the types of listings that are available. But of course, we just need to, be realistic in that this is a program that is developing over time, and I don't think overnight we're going to find an influx of programs coming in. However much we would love that to happen, I think it's going to be something that's going to take some time, and organisations may want to start thinking about how they can strengthen evaluation within their programs, and then start thinking about how to submit a program through the hub. So
one last question, this one from Marion, another member. So thank you, Marion, for sending the question through. Are we going to be providing regular updates on the programs that are passed through the evaluation process?
Yeah, so on the actual website, on the homepage, there's actually a section there that will highlight the latest program listings. So that gets populated as new programs go up on the hub. And of course, we will be doing a lot of communications out to our member organisations to give them insight into the types of programs that make it, just for case study's sake, and to give them some idea of how they might like to prepare their own submissions.
Absolutely right. We've got 10 minutes left, 9 minutes left. This is like talkback radio, but you have to look at someone else, That's why I used to say to people, I've got a head made for radio. Hey, and not a face made for TV. Let's talk about some final comments from our expert panel here, our panel of lovely people, about the importance of the hub, your final thoughts, and maybe some tips and insights for our viewers out there, not listeners, I've got to say viewers, our viewers out there. Christopher, starting with you, some final thoughts on why this is such an important initiative, and maybe also just some tips for our viewers out there?
Look, I think this is really important from the perspective that we've got a common goal. You know, suicide is still the leading cause of death for people under the age of 40 in Australia. And we've got a common desire to make a difference in that. And, you know, this is going to be a great tool for us to better understand the gaps, what works, where we can identify new things that we need to be addressing and how we can make better improvements in that. Because we've got to change the tide in what's happening for suicide in Australia. And that's one of the big challenges we've got. So I'm excited from the fact that, you know, we've got a tool now that we can share and we can actually build quality into the entire sector, not just into a particular funded program or a particular activity. So I'm excited about that from that perspective. I'm also excited from the fact that we can actually go and utilise it and actually get a better understanding of what we can do individually, collectively as services and organisations. So it's certainly something I'm going to be talking to our staff and encouraging all of our partners in that space to go and actually have a look, utilise, put this information forward so we can get a rich level of information there that we can have a better understanding.
Now, Melissa, again, as a PHN, as somebody out there in the field commissioning work, I know we've mentioned it before and you've talked about it before, but maybe just to reiterate the point, for you at the coalface, working with service providers every single day and also the community, how important is this for you?
Very. So there's probably three key points that come to mind as I was listening to you, Chris, and that is, first of all, I think it's, you know, from a PHN perspective, it's very helpful to have a centralised place where there are going to be listings of evaluated, consistently evaluated services. And the fact, Michelle, that you were saying, you know, you're not going to be inundated overnight is probably a good thing, you know, because the whole point is that it's, you know, that there's that level of rigour behind it to be on the hub. I think secondly, from a PHN perspective, like I was saying, we want to have confidence in, given the finite resources that we have, we have a responsibility to ensure that the services that we are funding can demonstrate an impact. So that's really important. And then thirdly, like I said before, to be building the confidence and capacity of the sector to be doing evaluation in the context of their service, you know, given the time constraints, given everything else that's going on the ground, to have an opportunity to have guidance and mentoring to make doing good evaluation more appealing, more realistic, and also so that providers themselves feel like they are value-adding, you know, back into the community as well.
Now, Alan, as our resident evaluation research guru, talk to us a little bit from your perspective now, as just summing up your hopes, I guess, for what the hub can achieve.
I want to just go back in history for a moment and say, you know, today is in many respects a realisation of what people working in suicide prevention, members of Suicide Prevention Australia, have wanted. You know, this goes back to the days of the 2010 Senate inquiry. One of the recommendations from the sector or those working in this field said that we think we need to have a better understanding of what works and why. We need to be able to share our knowledge and our expertise. We need to be able to cross-fertilise programs and services. So here today, we have got a tool through the Best Practice Hub, matched also to a national research fund for suicide prevention, matched to primary health network and regional suicide prevention trials. You know, and I would like to commend the Australian government. We started today with a statement from the Minister for Health, and you can see what is happening when the governments, those of us working in the field through Suicide Prevention Australia, start to push for this. And the reason we've pushed for it is because we're not content with where things are at. So this is an opportunity for us, step by step, program and service by program and service, to share knowledge and to continue to do better in our vision.
And I think the important thing to be reminded of, it's a living hub. It's not something that is fixed and static like an Excel spreadsheet that really gets updated. Michelle, for our viewers out there, for our members out there, where to from here? So if you would just to give a push to get people more involved in the hub, and maybe also just mention those websites again.
Yeah, sure. So I would just really strongly encourage our member organisations out there to take a look at the website and really think about contributing to the evidence base. It's really important that we do get submissions that come through, because we can then, get an idea of what's out there in the sector and ultimately whether or not we're making a difference. So the websites for you there are www.suicidepreventionhub.org.au, and I'll also mention that site is publicly accessible through Life in Mind, which is coordinated by Everymind. So.
There you go. For all of our members out there, thank you very much for joining us. We're going to be wrapping up in a minute or so. I'd like to thank our panel for joining us, our guests here at the launch of the Hub exclusively to our members. And Michelle, you've got a lot of work ahead of you, haven't you?
Yes, very exciting time.
And that's exactly it. I mean, I think the word here is exciting. The words are exciting times. As a sector, we've talked a lot about collaboration. We've talked a lot about the need for evaluation and quality in the work that each one of us do out there in the field, both at the local community level, at the state level, and also at the national level. Some of the key messages that have come out of the exclusive member webinar, that it's not ruling anyone in or out. It's basically saying that, look, go in and put in your program details and begin the process of the first part of evaluation. Now, if you move through that and you are successful, fantastic. Then we've got organisations, obviously, like the PHNs that are on board that will be able to commission directly from the hub, which is a great thing to do. But if your program doesn't quite cut the mustard straight away, that's okay, because as part of the hub, we have a mentoring process that you can get involved and engaged with to bring your program through the evaluation process. And that is particularly in mind small to medium-sized members and organisations as well. The other tips and insights around evaluation, it's not about the evidence base as a complicated process. There are things that a lot of programs are already doing and already collecting. So maybe just sit down, particularly again if you're a small to medium-sized member, sit down and think about what that data is that you're collecting, including the anecdotal stories that go along with it to bring life to what the data is saying. And just sit down and have a conversation with yourself and your other team members about what that might look like. We've heard stories about the fact that it's not just about national programs. These are programs that live and breathe right across this great country of ours. I'm Matthew Tukaki, the Chairman of Suicide Prevention Australia, very pleased to be the Chair of the SPA. I'd like to thank all of our members right across the country who have been tuning in to this webinar. I'd also very much like to suggest that if there are any other questions that you might have, if you are watching this on the old Facebook or the old Googly Plus or wherever it is it's going to be posted, then you've always got an opportunity to send a question through to the team at Suicide Prevention Australia, or even just give Michelle and the team a call here at the office. And I'm sure that along with the posting of this video will be those contact details and that information. Of course, we couldn't do what we do without our members. A couple of weeks ago, we were on the National Roadshow talking to members about what it is that keeps them up at night. Research and evaluation definitely played into their minds, but also too was understanding what programs are already out there and operating that they could get involved with or even replicate in their local communities that could have meaning to them. Of course, I'd like to thank the Australian government, in particular the support of the Federal Minister for Health, Greg Hunt, and the work that he does, and of course the work of the Department of Health and Ageing. Thank you very much again for tuning in. Thank you wherever you are, and keep the questions rolling. And like I said, please very much get involved with this new creative national innovative hub run by Suicide Prevention Australia.